Edutainment Studios welcomes you to Alzheimer's disease. This module is part 1 of a 4-part series on Alzheimer's and is aimed at helping you have a better understanding of the disease. Alzheimer's is a disease of the brain, and it is the most common form of dementia. This disease affects memory, thinking, and behavior that is not typical of normal aging. It will progressively get worse over time. In this course, the objective is to help you recognize what Alzheimer's disease and other types of dementia are, identify how Alzheimer's affects the brain, and identify some of the causes. Alzheimer's is a disease of the brain, and it is the most common form of dementia. This disease affects memory, thinking, and behavior that is not typical of normal aging. It will progressively get worse over time. Although symptoms can vary, you will notice forgetfulness as one of the first problems. This tends to become so severe that it affects your ability to function at home or at work, and makes it difficult to enjoy any hobbies, sports, or other activities. Alzheimer's may cause you to become confused, get lost in places that should be familiar, and misplace things. You may even have trouble with speech and language. Speak to your doctor about any memory loss concerns you may be having. Dementia is not one specific disease. Dementia is used to describe a group of symptoms that severely affects memory, thinking, and social abilities in such a way that your daily life can be greatly affected. Alzheimer's disease is the most common form of dementia and accounts for up to 80% of all dementia cases. There are other types of dementia that include vascular dementia, mixed dementia, Parkinson's disease dementia, dementia with Lewy bodies, Huntington's disease dementia, Creutzfeldt-Jakob disease, frontotemporal dementia or FTD, normal pressure hydrocephalus, Down syndrome dementia, Korsakoff syndrome, and posterior cortical atrophy or PCA. The exact cause of Alzheimer's disease is still unknown, but we do know that it involves the failure of nerve cells and changes in your brain's tissue. There are certain risks that have been identified that increase the likelihood of developing Alzheimer's disease, the most common being age, family history, and genetics. Most people begin showing signs of it once past the age of 65. The risk increases by 50% after the age of 85. Your family history can be an important pointer to risk factors. If you have an immediate family member with Alzheimer's, you are more likely to develop the disease than someone who does not. It is generally known that genetics are in some way involved in Alzheimer's. Risk genes and deterministic genes are the ones that influence whether or not the disease develops. Risk genes increase the possibility, while deterministic genes directly cause it. Alzheimer's has been found in both. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 4-part series on Alzheimer's disease, and come back for part 2.